Hi, I'm Charlie Peel. I'm a health writer for MS Academy, and this morning I'm interviewing Sarah White about her experience at the CMSC conference.
Yes, hello. So I'm Sarah White and I'm one of the MS nurses at St George's Hospital in London. And I attended the CMSC conference virtually. And today I'm going to be just giving an overview of one of the sessions that I listened to, which was caring for women across the reproductive lifespan, which was the session was given by Riley Bove.
Okay, thank you. So one of the first questions that I'd like to ask you is that after listening to Riley's session, is there anything that you'd personally consider changing in your own practice?
Well, one of the things she talked about was when a woman is considering stopping their DMT to start trying to conceive, if they're on an oral contraceptive, is to actually to stop the oral contraceptive, but to continue on their DMT and use a barrier method of contraception until their menstrual cycle normalizes, so that they are ovulating properly. And then once that's happened, to actually then stop the barrier method and then start trying to conceive. Obviously stop the DMT at the same time. And that then lessens the time that they're not going to be on a DMT while they're trying to conceive, and therefore just gives them that added bit of protection because the time is less. And that's not something we do at the moment. And I just thought that was an interesting thought and something we can consider doing.
Yeah, absolutely. That is interesting. I suppose it gives the individual that bit more protection for longer before beginning starting their family. Thank you. So people with MS often ask us about their children's risk of MS. Do you have any advice to give on that particular subject?
I mean, Riley touched on this during her talk, and you know, we know that if you have a parent with MS, the risk of a child developing MS is still very small, but it's about 1.5%. And she talked about actually focusing on the modifiable factors, so ensuring the child has an adequate vitamin D intake, which, you know, when they're very young, you would be asking the advice of the health visitor for the right dose, and also making sure they don't smoke, and keeping their weight under control. So she talked about the things that you could do. So I think throughout her talk, she really focused much more on the positives and the things that you could do, rather than sort of negatives.
Fantastic. Yeah, that seems to make a lot of sense, the things that you can actually control yourself. Definitely. Did Riley cover anything specific regarding COVID-19 in relation to pregnancy during her talk?
Yes, she did cover it, 'cause it's obviously a topic everyone's talking about at the moment. And she said that we don't yet know whether COVID-19 could be passed from the woman, if the woman does have COVID-19, to the fetus, or the effect it has on the fetus as it's growing, and whether babies will be born preterm. So she said more research needs to be done. She then went on to emphasize the importance of looking after the woman through their pregnancies and focusing on the things that we do know are risks for COVID-19, such as hypertension, so making sure that's managed, diabetes, making sure that's managed properly, and obesity. So she focused on those things.
Okay. More about overall health and well-being. Thank you. Okay, and what did you learn specifically about caring for women during their menopause and beyond that particular landmark?
That a lot of symptoms that people with MS have overlap with menopause symptoms. So things like sleep, or difficulty sleeping, mood, sexual dysfunction, bladder. And so that when you're seeing a woman who's of menopausal age to consider, if they're reporting new symptoms, that they might be because of the menopause rather than the MS. You still need to treat the symptoms, but she said just to bear that in mind, and to really, as a woman ages, to think about keeping them as healthy as possible. So looking at other things like bone density, which can become a problem as women age. And again, looking at their DMT that they're on, and is it still the right one? And then an intensive focus on symptom management and really helping women to keep as healthy as possible as they age.
Fantastic, thank you. That's been really interesting. Before we finish, is there any particular reflection that struck you, or a particular take-home message that Riley prioritised above others that you could share?
I think her talk really was, she focused a lot on individualising care, so to to treat each woman as an individual, and really focused on the positives and the things that we can do to optimise health at every stage. She talked a lot about collaborative working, so for example, when women are planning for pregnancy, to make sure you're working alongside the obstetric team. So I think they were the key themes that came out in her talk.
Thank you, Sarah.